Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
If you're one of the tens of millions of people who suffer from carpal tunnel syndrome, then you're already familiar with the symptoms. In your hand or fingers, you're probably experiencing pain, numbness, tingling, burning, itching, and a loss of strength. Most likely you find it difficult to do everyday things with your hands. Like most Americans, you've probably resorted to taking painkillers to ease the pain, not knowing that most of these painkillers are toxic and dangerous, and result in over 16,000 deaths per year. That's because virtually all of these painkillers are not made to be taken chronically. If so, they will cause damage to various organs. Most people are surprised to find that more people die each year from taking these painkillers than from AIDS or cervical cancer in the US. So if we can't take painkillers chronically, what else are we supposed to do for our carpal tunnel syndrome? You probably already own a bucket of splints and braces that don't seem to help a lot. And if you've had steroid injections, you know that the effects don't last very long, and you can't have very many of them. Some people are misinformed and think surgery is their only real option, but this can't be farther from the truth, because studies show that most people who have surgery are dissatisfied with their results, but the overwhelming majority of people who use non-surgical therapies to treat their carpal tunnel syndrome are quite satisfied with their results. That statistic is so important that the American Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. So what else can you do to treat your condition that's effective, permanent, and safe? The answer is deep tissue massage of your wrist and forearm. It's nearly 100% effective in treating carpal tunnel syndrome, but it must be used daily and for at least 2 to 4 weeks, otherwise it's ineffective. But this isn't your everyday massage. It requires specific motions on the wrist and forearm that, over time, will drain excess fluid and break up adhesions over the flexor tendons. This will reduce inflammation, thus reducing your hand pain and other symptoms. So as you see, you don't need dangerous drugs or surgery to treat your condition. Instead, professional deep tissue massage applied daily will be nearly 100% effective in alleviating your symptoms. To get this professional therapy for these conditions causing your hand pain, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have hand pain due to carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury, then you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers, treating you for carpal tunnel syndrome, wrist tendonitis, or repetitive strain, except it treats you every day at a fraction of the cost of a therapist and in the comfort of your home. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.